Let's jump right in. Welcome to your recovery journey. I'm so glad you're joining us for this explainer today because what we're going to cover is absolutely vital. This is your essential step-by-step post-operative care guide for your Paramedian forehead flap procedure. Now, I know right after surgery, there's just a ton of information thrown at you, and it can feel pretty overwhelming. But hey, don't worry. That's exactly why we're here. We're going to walk through everything you need to know together, nice and easy, so you can feel completely confident caring for yourself at home. So let's dive into it. First things first, we really need to talk about what's completely normal right now, just so you weren't caught off guard. When you look at the mirror, you're going to see a pretty large, bulky white bandage made of gauze and tape. It's there to protect you and, importantly, to help control bleeding. Now, speaking of bleeding, it is totally normal and expected for the first 24 to 48 hours after your surgery. In fact, that bulky bandage might even become completely saturated and leak a little blood during this time. I know seeing that can be super startling, but honestly, it's just a standard part of the immediate post-op experience. So the real trick here is knowing exactly how to handle that bleeding when it happens. If you start bleeding, you need to press firmly and directly over the bandage with some gauze, a clean paper towel, or a washcloth. And listen closely because this is the absolute most important part of this instruction. You must hold that firm pressure for a full 30 minutes. Literally without lifting your hand to check on it. I know, it's incredibly tempting to take a quick peek after 5 or 10 minutes to see if the bleeding stopped, but releasing that pressure actually disrupts the whole clotting process. Give it a full 30 minutes. You might even need to repeat this a couple of times before it stops completely. And please never remove the bandage yourself to stop the bleeding. If it simply will not stop after several 30-minute attempts, that's when you pick up the phone and call the office. Now, what's truly fascinating about this specific surgery is how it actually works. This is a 2-stage repair. That means there's a vital bridge of tissue currently staying connected so your new skin maintains its blood supply. I really want to pause right here and emphasize this next rule because it is hands down the absolute most important rule of your entire recovery. Do not remove, adjust, or manipulate the bridge of skin between your forehead and nose. Seriously, you must protect that bridge of tissue at all costs. Keep your bandage right where it is and keep it completely dry. Just let the medical office handle all the bandage changes. If your bandage gets completely soaked with blood within that first 24 hours, call the office to schedule a change. Otherwise, you'll just be seeing them for your weekly bandage changes. But what happens if the unexpected occurs and the bandage actually comes off on its own while you're at home? Well, first things first, call the office right away to let them know. Then, after thoroughly washing your hands with soap and water to keep any infection away, you'll follow these exact daily wound care steps until your next appointment. Step 1, clean the incision gently with mild soap and water. And remember, do not touch or manipulate that bridge of skin. Step 2, apply a really generous amount of Vaseline over the area. And step 3, just cover it up with a clean bandage. Any standard clean bandage you have at home is perfectly fine for this temporary coverage. Okay, let's be totally upfront here. Your body is doing some incredible heavy lifting right now, and the area is going to look and feel pretty uncomfortable before it gets better. Healing from a procedure like this is a journey, so we need to clearly separate what's just a normal part of the healing process from what might be a sign of infection. Let's take a closer look at what you should anticipate. Here is what you can absolutely expect as part of normal healing. You're going to see bruising, color changes, and swelling around the surgery site. If the surgery is on your head, the swelling can actually get so severe that your eyes might temporarily swell shut. Or if it was on your nose, it might feel super stuffy, almost like there's something stuck up inside of it. Please be reassured, all of this is perfectly normal. It's really just your body rushing healing fluids to the area, and it's going to slowly dissipate over the next 1 to 2 weeks. To help manage this, keep your head raised for the first 48 hours. Grab a few extra pillows, or maybe even sleep in a recliner. Also, make sure you don't sleep on the side of your body where the incision is. You can definitely use ice to help with the swelling, but only apply it around the area, like near your eyes. Never put ice directly on top of the incision itself for those first 48 hours. Moving on to managing your comfort. You can go ahead and resume all of your usual medications right now, both over-the-counter and prescription. If you stopped taking anything before your surgery, you can safely start taking it again. For pain relief, over-the-counter medication is the way to go. The specific recommendation is to take 2 extra-strength Tylenol, which is acetaminophen, along with 1 to 2 ibuprofen, like Advil or Motrin, just following the directions on the bottle. You can take these together every 6 hours unless you have a medical condition that prevents you from doing so. Also, if the nurse discussed an antibiotic with you today, please make sure you grab it from the pharmacy and take it exactly as directed. Pro tip, always take your antibiotics with food to avoid an upset stomach. And if you experience any side effects or reactions to the antibiotic, just skip the next dose and contact the office immediately for further instructions. To protect that delicate flap of tissue, we've got to set up some very firm boundaries regarding your activity and skincare. Until you are explicitly cleared by the doctor at your next surgery, there is absolutely no heavy lifting, no heavy cardio, no bending, and no strenuous activity. Light walking is totally fine, but avoid anything that spikes your blood pressure, makes you sweat, or puts any tension on the wound. Most importantly, do not blow your nose or do any movement that pulls on the flap. When it comes to your skin, do not apply any sunscreen, makeup, or specific scar products like Silogen to the area. You'll get all those specific instructions for those routines at your second stage appointment. All right, now we must transition to emergency protocols. There is one specific number I really want you to keep in mind over the next week. That number is 5. There are 5 highly specific warning signs of infection that you need to be actively keeping an eye out for. These symptoms most commonly pop up between days 3 and 7 of your recovery. Here are those exactly 5 clinical warning signs to watch for. Number 1, a fever over 100.4 degrees Fahrenheit. Number 2, chills. Number 3, any spreading redness, warmth, or swelling around the site. Number 4, thick yellow or green drainage. And number 5, pain that suddenly worsens after day 3, or pain that starts getting worse after it had initially been improving. If you experience literally any of these 5 signs, call the office immediately. I also want to quickly remind you to call the office if you have bleeding that simply will not stop after those repeated 30-minute pressure attempts we talked about earlier, or if you experience strong itching and bright redness around the tape. That usually means you're having an allergic reaction to the bandage. I know we've covered a whole lot of strict rules and symptoms to watch out for today, but I want to offer you the light at the end of the tunnel. Remember, this is a process. Your second stage, or takedown surgery, should be scheduled for approximately 3 weeks from now. That is the day the bridge of tissue will be addressed and you'll receive your next set of instructions for the final phase of your healing. You are on a very clear path forward, and honestly, the hardest part right now is simply being patient and protecting the surgical site during these next few weeks. Finally, I want to leave you with this really simple, reassuring reminder. You are absolutely not doing this alone. The medical team at Advanced Dermatologic Surgery is completely ready to help you out. Whether you just need a simple bandage change, you're unsure about a weird symptom, or you experience any of those warning signs we covered today, do not hesitate to reach out to them. Your safe and successful healing is their absolute top priority. Thank you so much for joining us for this explainer. As you rest up and follow these guidelines, I want you to ask yourself, what is the one thing you are most looking forward to getting back to once your healing journey is finally complete? Hold on to that goal, and we'll see you at your next appointment.